Hello, this is Dr. David Tam, President and CEO of BB Healthcare, and welcome to our live video town hall from the Margaret H. Rollins campus of BB Healthcare, and today is October 19th, 2020, as we share with you the most up-to-date information about where things stand with the COVID-19 pandemic. As you know, the pandemic is not over and changing globally and nationally, and even in the state of Delaware. Our goal here is to provide the most up-to-date, valid medical information about what is going on right here in Sussex County in our community, so that you can make the best decisions possible with us to take care of yourselves, your families, and this community. And so without further ado, I'm going to turn this over to Dr. Bill Chasanoff, infectious disease specialist at BB Healthcare and our medical director for our COVID-19 response. Dr. Chasanoff.
Thank you, Dr. Tam. So as Dr. Tam was mentioning, that I am Bill Chasanoff. I am an infectious disease physician here at BB Healthcare. I'm going to check for a second to see if the interpreter Pam can hear me. Jamie, do you want to step in for her? Wonderful, thank you. So again, my name is Bill Chasanoff. I am an infectious disease physician here at BB Healthcare, and I've worked here for the past 3 years. For those of you who are joining us again for a town hall, I welcome your time and thank you for joining us this afternoon. I was born and raised in Milford, Delaware, on the Sussex County side, and consider myself a long-term Sussex County resident. Sussex County is my home, you are my family, and you are my community. So as we talk about things over the next few minutes, I want you to know how important your health means to not just myself, but also to everyone that you're going to hear from in the next few minutes. At BB Healthcare, as Dr. Tam was mentioning, one of my roles here is the COVID-19 medical director. What that basically means is that I am tasked with keeping an eye on what is happening not just close to home here at BB Healthcare, but also in Sussex County, the state of Delaware, the United States, and truly the world or globally. Over the next few minutes, I hope that I can update you with as much current, valid information that I have been seeing over the last several months. I want to start by sharing some data with you, and I will start large globally and then bring it down more locally to Sussex County. We reached a landmark in the world where we have over 40 million confirmed COVID-19 cases. Out of those confirmed cases, we are happy to say that about 28 million are considered recovered. Moving to the United States, we also have crossed over a landmark where we now have over 8 million confirmed cases throughout the 50 states. In Delaware, we have 23,093 confirmed cases of COVID-19. Out of those, over 12,000 are considered recovered. Sadly, we have lost approximately 665 Delaware residents due to COVID-19. Currently, there are 106 patients hospitalized throughout the state of Delaware because of COVID-19. Out of those 106, 21 of those are requiring critical care. In Sussex County, we have had over 7,500 confirmed cases of COVID-19. Out of those, 4,025 are considered recovered. We have unfortunately lost 214 Sussex County residents due to COVID-19. I tell you this not because I have secret inside information. This information that I give you, any of you are able to look at any moment of the day through either the Johns Hopkins Coronavirus Tracking website and or the state of Delaware My Healthy Community website. So I have not divulged any information that you cannot find yourself. This information is updated at least daily. Why we are talking to you, or at least part of the reason we are talking to you in this update, is to tell you that we are seeing increased positive cases in Sussex County, in the state of Delaware, and then throughout the country, and then throughout the world. This is not something that is just concerning to Sussex County, but this is something that's concerning to all of us, even outside of our state. I'd like to share a chart with you showing the trending up of positive cases that we are having in Sussex County. Again, this information is found through the State of Delaware website. This is over the course of the last 14 days. I want to show you that this dotted line that is right here is an average line, a trend line that they call it, that is moving in an increasing manner. It is not decreasing, it is increasing. And these spikes that you see are the number of positive cases on a daily basis. It's important to recognize that just because we see positive cases, this does not always equal more hospitalizations. But unfortunately, in this case, that is what we are seeing. This next graph that I'm going to show you is the past 2 weeks of hospitalizations in Sussex County. And again, you see this dotted average trend mark line that is moving upwards. It is increasing, it is not going down, and the bars underneath of it are higher than they were when we started a couple weeks ago. That is not a trend that any of us want to see. To put that into perspective, this next chart I'm going to show you actually starts towards the end of March and encompasses the entire state of Delaware. This is the hospitalizations for the entire state of Delaware from the beginning or around the shortly after beginning of COVID-19 on this side to where we are now over here. I put this red bolded line in there for you because this is where we had our lowest area of COVID-19 hospitalizations throughout the state. As you see, we never went down to zero, and now you see these bars moving upwards, showing that we are having an increase in hospitalizations throughout the state. Again, we have 106 hospitalized COVID-19 patients throughout the state of Delaware, and out of those, 21 are requiring critical care. So approximately 20% of all patients hospitalized in the state are requiring intensive care unit level of care. How can we slow this down? So I'm going to show you one more chart that shows the top 5 venues as State of Delaware epidemiologists track new cases. These top 5 venues are venues that are where people have been in at least the 14 days prior to being diagnosed with COVID-19. I do want to put a disclaimer in here. I am not saying that anyone has actually gotten COVID-19 from these venues, but I do think that this is interesting, and you can find this again on the State of Delaware website. So if you look here, these top 5 venues that are listed include restaurants, which is the top number, religious services, the beach, and then wedding and gym are 4 and 5. So the top 5 venues, the 14 days prior to the contact tracings for COVID-19 positive patients in the state of Delaware, those were the top 5 places that were listed that they had been. So it's important to recognize that the things that we started to talk about months ago, such as washing our hands and physically distancing, are all just as important as they were 6 to 7 months ago. As regulations and rules have loosened and they allow for social gatherings up to a certain amount, I ask you to please make wise decisions individually with you and your family if those social gatherings are the right place to be. If you are going to go to a social gathering, try to limit it. If it needs to be, please try to make it outside if you can. I know that we all have something called COVID fatigue. We are all tired of hearing about COVID, the restrictions that COVID has put on all of our lives. I feel it. My colleagues feel it. Every single person talking to you right now feels this. But we need to do what's right, not just for you, but for your family, for your coworkers, for your neighbors, for your entire community. Through these acts that we do, as simply as putting a mask on, it will save someone's life. And that's what's really important. To know that we're all part of one community, however small we think that is, it's attached to a larger community, and we need to do what's right to keep us all safe. My last plug that I will tell you is if you are able to get your flu vaccine this year, please, out of all years, this is an important year to get your flu vaccine. I want to thank you for your time this afternoon. It's my pleasure to turn you over to my colleague, the Senior Vice President of BB Medical Group, Dr. Gulab. Thank you for your time.
Hello, everyone. Thank you for your time today, and thank you for this opportunity. My name is Bobby Gulab. I'm the Senior Vice President and Chief Medical Officer of our BB Medical Group. Similar to Dr. Chasanoff, I am also local. I grew up in Sussex County. I grew up in Millsboro, about 20 minutes from where I am sitting right now. I also feel this is my community, and I've always felt that way and always knew I wanted to come back here and practice medicine and also take a leadership role at the hospital to be able to affect change in a positive way. So I wanted to spend a few minutes talking about the BB Medical Group and also about primary care and walk-in care and what we have available, especially during these difficult times. The BB Medical Group is BB Healthcare's group that all of our physicians, nurse practitioners, physician's assistants are all part of. We have 179 providers, 47 locations, and 21 specialties that we cover in Sussex County. 2 of those is primary care and walk-in care as well. We have 24 primary care physicians, 10 advanced practice providers, nurse practitioners and PAs, and we have 12 locations in Sussex County. Primary care is one of the most important things you can do for your health. Your primary care doctor is not only someone that you would see when you're not feeling well, but it's also where you get your preventative care as well. And that's why primary care is so important these days. We understand and know that there's challenges and there's shortages of physicians nationally, and primary care physicians is actually one of the largest shortages nationally. We have, in the last year, brought on 4 primary care physicians and 4 advanced practice providers as well. We have 1 more advanced practice provider starting in the next 2 to 3 months, and we also have 2 more physicians starting in the next 2 to 3 months as well. So we do know there's a shortage, but we also know our responsibility to the community. And BB Healthcare is a nonprofit, and we are here to serve the community, and BB has done that for 100 years. One of the things that I like most about working for BB is the strong ties of the community. And whenever we interview a physician, a nurse practitioner, or anybody, well, that's one of the things I always tell them is the strong connection we have with the community and how important it is that we continue to support them. And we'll continue to do that with our primary care services. And we will continue to aggressively recruit primary care physicians, nurse practitioners, and PAs to the area to continue to meet the growing demands that we have. We have also more recently started a centralized process for getting people in the community primary care appointments. So we do have a phone number now, 302-645-3332. Anyone can call that number and can get set up with one of our primary care offices. And they can discuss it with you. They can see what's a good fit for you, depending on the location, depending on the providers that are available, and really try to get you set up for a long-lasting relationship with one of our primary care providers. I'll repeat that number, 302-645-3332. So if you're looking for a primary care provider or know anybody that is, you're welcome to share that number with them. It's also on our website as well. So please keep that in mind. And if anybody does not have a primary care provider, please look at setting that up as soon as possible. We do have, as I said, new providers have come on board who are taking patients as well. So we should be able to get you set up. And especially during these times, it is very important that you do have primary care services available to you, not only to get through the pandemic, but for your overall health as well. And they really are your partner to help you if you need to get connected with specialists or other services as well. Due to the high demand, we also have walk-in services, which I wanted to spend a few minutes talking about also. Walk-in services are exactly that. You can walk in, be seen right away. And it's usually utilized by people who don't have a primary care provider. It's utilized by people who find it more convenient to do so, or they may need a service that probably is not provided at their primary care office, such as, a laceration repair or those kinds of things. The walk-in services we have 4 in the area. We have 1 in Millsboro, 1 in Georgetown, 1 in Rehoboth Beach, and 1 in Millville as well. Now, with COVID-19, we are still seeing patients in our primary care offices and in our walk-ins. We've also incorporated telemedicine services as well. We know people are a little concerned, they're anxious, they may not want to go out, but all of our primary care providers are seeing patients through telemedicine services also. So that's an easy way to connect with them, because if you have chronic conditions or you're not feeling well or if you have care that's been delayed, we don't want you to avoid getting that. We want you to know that we're here to provide that care, and you can connect with us through a telemedicine fashion as well. And if coming into the office is the best way to do that, we are available and we are open, and we will continue to maintain our operations to be able to care for patients in our community. One of the things I also wanted to comment on is the other services that we have available. As we start to see cases start to increase, we do have a COVID care center available as well. That's for COVID positive patients, and that's for patients who may be under suspicion for being COVID positive as well. We have a call center that can be utilized if people just have questions, or if they don't have a primary care doctor and feel that they have COVID-19 related concerns, they're welcome to call that number. We also have a testing center available. So if you see your provider through a telemedicine fashion, and they feel you need testing or to get a COVID-19 care test set up, then we can set you up for that test as well. So we like to incorporate all of our services, and they all link together, from our primary care services, our walk-in services, COVID care center, call center, and our testing center, and really like to be able to provide the patient the right service that they need at the right time. And your primary care provider can help you with that, the walk-in can help you with that, or the call center can help you with that as well. Now, one thing I did want to comment on is safety. So one of the things that we do want to make sure is that we are taking care of patients in as safe an environment as possible. So we do have screenings put in at all of our offices. That did start when COVID-19 issues in the pandemic did start, and we have continued those. So we still have those in place, and we continue to utilize that. We also have screenings in place where we're calling people if cases really pick up, to screen before they come in. And when people call us for whatever reason, we also offer them screening and connection to other services as well. We also have workflows put in place. So if somebody is COVID-19 positive and needs to be seen in one of our offices, we have a workflow of our staff being safe, wearing all the proper equipment and taking care of them. And if you come into the office and you don't have COVID-19 but need your regular care, we also have systems, processes, and workflows in place with proper distancing and spacing to make sure that everybody's getting the right care that they need, but we're doing all of it in a very safe and an effective environment. So the last thing I'll comment on is just please being safe yourself. As Dr. Chasanoff alluded to, we are seeing cases increase. We really appreciate this opportunity to connect with you. But one thing is for sure, to really control the pandemic in this area or in any area, it really comes down to the people and adhering to all the guidelines, the precautions put in place, and just being careful and being responsible. Because without that, we can do as much as we want, but we will continue to see cases increase. And everybody has their role and their part to play. And we'd like to all move on and put this pandemic behind us as soon as we can. And a big part of that is following all the guidelines, the regulations, the rules, the restrictions that are put in place, and just being as careful as possible. We know it's a sacrifice. We understand it's a change in the way we have been living our lives. And we know it's difficult. It's difficult for every one of us. But the sooner we can get past this, the better off we'll be. And part of that is being as responsible as possible and following all the precautions that are put in place. So thank you very much for your time. Hopefully we gave you some good information and some good information about our primary care services, walk-in services, and some of the other things that we are doing here at BB to continue to support you, meet your needs, and to provide quality care for you. At this time, I will turn it over to Tom Protak, who is the president of the BB Medical Foundation.
Good evening, everyone. My name is Tom Protak. I'm the president of the BB Medical Foundation, and I want to thank you all for participating in this public virtual town hall meeting tonight. As we like to say, it's a marvelous evening here in Sussex County. I want to thank all my colleagues who shared so much vital information with us. As the theme was over and over stated, we are neighbors taking care of neighbors, families taking care of families. So it is important for all of us to do our part to keep everyone safe. As president of the foundation, I want to thank each and every one of you. So many people have reached out to the BB Medical Foundation to make a donation to support us and to help us during this pandemic. As Dr. Tam shared in the beginning, it is not over. We are still navigating these courses and not too sure what the future will hold for us. But what we do know is that we still need your help. So many of you have made a donation for the very first time to the COVID Relief Fund. We were able to raise in a very short period of time over $2.1 million here in our local community. What does that tell us? That tells us at BB Healthcare, and it tells all the BB heroes who work day in and day at night, keeping us safe, that they are loved, that they are cared for, and that they are trusted, and that they are important. So thank you for all who made a donation, and thank you to all those who made a donation for the very first time. Many donors called and said, now I realize how important our hospital and healthcare system truly is, how important it is that BB is strong, that BB has all the resources it needs, not only to fight this pandemic, but to keep each and every one of us safe. So many businesses reached out to us and made donations of supplies. I want to thank all of them. So as we continue to work our way through this pandemic, we still need your support. Our CFO shared in a meeting earlier on today that it costs BB Healthcare $1.2 million a day to turn the lights on, to take care of us. As a local not-for-profit community healthcare system, your support is appreciated, it is needed, and we could always use more help as the future is unknown. What ways can you help us? One of the neat things we're doing now, and I know many of you have seen it, Dr. Chasnall had his little prop. I'm going to show my prop. This is a Tanger Pink card. We have partnered with the Tanger outlets where you can purchase one of these cards for only $10, and you get 25% off a single item in participating stores all during the month of October. We've had to cancel all of our large public events, but we are still actively fundraising, and things like the Pink Card program are easy ways for you to participate and to support us. Also, this Sunday, October 25th, we are doing an outside venue at Hudson Fields called This Is Halloween, where it will be an outside, socially distanced, safe environment where we will celebrate Halloween. There will be music, there will be vendors, there will be a costume and parade, and movies in the evening. So take a look at our website to learn more about it at bbmedicalfoundation.org, or give us a call at 302-644-2900. Again, on behalf of all the BB heroes who you have helped, who you have supported, thank you.
Thank you, Tom. Well, it's been a great almost hour now, 45 minutes of conversation with you. And I'd like to close it off by sharing with you and summarizing a few things. First of all, you heard from Dr. Chazanov that COVID is still here, not only in the world, but even here in our part of Delaware in Sussex County. It is still out there. People are still getting infected, and people are still being admitted to the hospital with the coronavirus, COVID. The numbers are continuing to go up. It is unclear to us whether that will be something that will continue or whether that will stop and flatten out. We are in a time when the weather is getting cooler, people are staying indoors more, and of course, all of us and I mean all of us, feel that pandemic fatigue where we want to spend time with family and friends, and maybe perhaps some of our discipline has slipped. And now is the time for us to reevaluate and reassess what we are doing to make sure that we do everything we can to flatten the curve and see if we can beat down the COVID-19 numbers in our part of the county. Please remember, though, that the hospital itself is safe. Even though the numbers are up, as Dr. Chazanoff showed you, the hospital is still safe. We have learned much in the 7 months of this pandemic. We have learned better how to take care of patients, how to treat people who have respiratory or cardiac or neurologic issues. We have learned more about the medications that we can use in the treatment modalities to treat patients with COVID-19. We have learned how to extend our supplies and our capacity. And the hospital is now safe here at Beebe Medical Center and at the Margaret H. Rollins campus. Why do I say that? Because our hospital is open and our ERs and our clinics are open. And I share that with you because please, 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 if you need us, we are here for you. That is the commitment that we make as an independent, local, nonprofit community health system, that we are here to serve you. You know, I'm a neurologist by training, and strokes don't wait because of a pandemic. Heart attacks don't wait because of a pandemic. And appendicitis doesn't wait because of a pandemic. Cancer doesn't wait because of a pandemic. And what we want to do is keep Beebe strong so that you can come in and get the care that you need to make sure that you are treated appropriately if you are having symptoms of a heart attack or a stroke or an appendicitis, or if you're concerned about whether or not there is an increase of a chance of cancer or something like that. I am not trying to scare you, but I want you to know that if you feel that you need to be seen, Beebe Healthcare is here for you, and we are safe. You also heard from Dr. Gulab that our clinics are safe and are open. We have new primary care physicians coming in, and we are recruiting heavily. You know that there is a shortage of physicians here in Sussex County, and Beebe Healthcare is at the leading edge of bringing in not just primary care physicians, but specialists to take care of the community as best as we can. That's why we also have the walk-in clinics, which were busy during the summer, but now we have kept them open so that you can get the immediate care that you need if you have a problem or a concern that connects you to the hospital or to the emergency room or other specialists if it is required. And once again, we want you to know that every aspect of Beebe Healthcare is patient-focused. That means that we are centered on the patient. This means that if you are coming into the emergency room, at this point, we will welcome a family member to join you because people in the emergency room need a visitor or a family member to help share information about medical history, about medications, about what's going on with the symptoms. We know that you are at the end of life. You will need somebody to be visiting you in the hospital to make sure that your needs are being met, that your decisions are made correctly and appropriately for you. We have changed our visitor policy so that if you are a stable inpatient, we ask that you not have a visitor with you, and that we will monitor and observe and make any changes as we can to make sure that you are taken care of in a patient-focused and patient-centered way. Why are we doing these things? Because we still need to make sure that the hospital is a safe place, that we continue to protect the hospital against any kind of increased infection. Why? Because being patient-centered means that when we are in the wintertime and you need a hospital to go to, that you need health care, that we are here to provide that care for you, that we are here and that we are strong and we are able to make sure that all your health care needs are met. So please help us help you as we face this battle together, and do everything that you can with us, with things like visitor policies and taking care of your loved ones as best as we can. We need to continue to remain Sussex strong because at this point right now, there are only three things that we all can do. And I know that pandemic fatigue has really set in, but the three things that kept us and that curve low or flat, as Dr. Chazanov showed you, are still the three W's: washing your hands, wearing a mask, covering your face, and watching your distance, trying to be physically distant and staying away from crowds as much as possible. There's nothing more than I want to have a large Thanksgiving gathering or trick-or-treating with the kids. But we must work together to perform those three W's as individuals to help protect our community. And I don't say that in a preachy way. I say that in a way to say, please, let's all work together, because that's how we got to the point where that curve was flat. And we need to keep it flat as we go through now the winter months when other people get sick. You also heard from Dr. Chazanov that we all need to get our flu vaccine. Flu vaccines are limited right now, and we are doing everything we can to make sure we get as much flu vaccine as possible so that we can ensure that everyone who needs one gets vaccinated. The best thing you can do is continue to go online at bbhealthcare.org, where we can tell you what is going on with our flu vaccination clinics and whether they had to change or cancel as a result of any flu vaccine shortage. You also need to know that if we don't have that flu vaccine, if you call our flu hotline, we will do everything we can to make sure that you know where to get that flu vaccine in the community. This is not about who's right, who's wrong, who's winning, who's losing. It's all about how to make sure that we take care of you and get you what you need so that you can get that flu vaccine and protect yourself from the flu, because you don't want to get COVID while you're sick with the flu. That just makes you more at risk for getting into the hospital and getting sick. Finally, please make sure that you take care of yourselves during this time. Pandemic fatigue is a lot like what, when I was in the Navy, we had where people had combat fatigue, where people were just tired of being deployed over and over again. Here are some things that I ask you to do. Take care of each other. Share your anxiety, your stress, your feelings of depression with each other. Make sure that you watch over others so that if you see somebody, a friend, a colleague, a family member who is having symptoms, let a doctor know. Let us know here at BB Healthcare so we can try and get you the support and care that you need. Make sure you get plenty of rest. Now is the time to make sure you get good sleep and your exercise. Stay outside if you can, get some exercise, go for a nice walk in a physically distant way, because we all need to stay as safe and as strong as possible to not just fight COVID, but fight the pandemic fatigue that all of us are facing at this time. The last thing I'll say today is to say thank you. You have been with us throughout the last 7 months as we have faced the pandemic together. Now is the time to continue to say thank you to you and have gratitude for the way you continue to support us throughout this time. I also want to say thank you to all other frontline workers, our police, our firefighters, our paramedics, our skilled nursing facilities, and other people working in long-term care. And I'm also going to include the teachers who are working so hard to try and remain safe during an environment where we have to also do everything we can to take care of our children during this time. Thank you, thank you, thank you for all the work that you do. And personally, I just want to say thank you to all of you in the community. I've been here now for 7 months with my wife and our kids, and everywhere I've been, we have been so welcomed, so felt at home. This is our community. You've heard from doctors like Bill Chazanov and Bobby Gulab, who are from here and have a special investment to making sure that we take care of you. Thanks to your welcome, thanks to your encouragement, I also feel right at home. And we are all together here at BB Healthcare committed to making sure that we are here for you, that we have patient-centered care as best as we can, and that we look forward to continuing to be your healthcare leader during the days ahead. Please be safe, please take care, God bless you, and thank you very much for listening and watching today.